Welcome back to McLaren Port Huron's Today's Health, and we're talking with Dr. Michael Basha. Dr. Basha, we talked a little bit about severe asthma, but can you run through those options for treatment?
So severe asthma is, for example, somebody who is on all the normal treatments for asthma. They're on the bronchodilators and they're on steroids and other medications that we typically use. And despite all of that, they're still having a number of complaints. They have frequent trips to the emergency room, frequent trips to the office, multiple admissions to the hospital. And despite a really good intensive regimen, they're still having a lot of symptoms. So then we start thinking about other modalities for those individuals. And so we talked earlier about some of the newer medications. There's a medication which is a monoclonal antibody against the antibody IgE. It's called Xolair. It's a very effective drug in patients with allergic asthma. There are monoclonal antibodies against interleukin-5. Interleukin-5 is a protein which attracts certain cells into the lungs which are important in the asthmatic response. So there are 3 different medications for, that work against interleukin-5. We mentioned them before. And then there's another drug called Dupixent, which is a monoclonal antibody against interleukin-4 and 13. These are both important proteins in the asthmatic and allergic response. So these are medications which can be used in those severe persistent asthma patients who are still having lots of complaints.
And I know you mentioned the procedure, bronchial thermoplasty. Can you tell me about that?
Yeah, this is an exciting technique. This is a procedure that's done in the operating room under general anesthesia. We typically will bring the patient back for 3 treatments. They're about 3 weeks apart each treatment. We work on the right lower lung first, then the left lower lung, and then the upper lobes last. And basically this is a technique that we use through the bronchoscope. So we place the bronchoscope into the lung, and then we use a special catheter which has a heat probe on the end of it, and we apply heat to the airways. And what the heat does is it actually destroys the smooth muscle which surrounds the bronchial air tube. So by doing that, the constriction of the lung is impaired, and those patients do not have that narrowing of the bronchial air tubes that they typically will have when they're having an asthma attack, and it helps to settle down their asthma and control their asthma better. So this is the technique which is useful in treating patients with severe asthma, and it's very, very useful as an adjunct to patients with severe disease.
So let me just see if I understand. You actually shrink that muscle, and that's how this treatment impacts this or lessens the symptoms.
Right, because remember, asthma is a disease which is characterized by inflammation of the airways and constriction of the airways. The constriction of the airways is caused by the smooth muscle which surrounds the bronchial air tube. So by going down there with a special heat catheter and destroying that smooth muscle, and it being replaced with fibrous tissue, the bronchoconstrictor response of the airways is lost, and it helps to control the asthma better.
So if you have a successful procedure for this, does that mean you don't have to take your medications?
Well, many of our patients that we've done this procedure on can cut back on their typical asthma medications, and we've had a few patients who've completely gone away from their asthma medications. This typically will result in, fewer visits to the hospital and to the emergency room and fewer trips into our office.
So could you say then you don't have asthma anymore, or do you still have asthma and you need to manage it?
Well, they still have asthma, but it's much more controlled, and typically most patients can cut back on the medications that they use for controlling their asthma.
Who's eligible for this procedure?
So this is not for patients who have mild asthma or seasonal asthma. This is for patients who have severe, persistent chronic bronchial asthma. These are patients who are typically on all the normal medications for asthma plus, and they just continue to have symptoms, and they have breakthroughs, and they really need something more for their control.
If our viewers are saying, boy, that's me, what are the next steps?
Well, the next steps is to just, make an appointment to see us in the office. We'll evaluate them, see if they do have this type of asthma, and if they do, then we'll see if we can't get them scheduled for this type of procedure. Again, this is done in the operating room under general anesthesia. There are 3 sessions, 3 weeks apart, and the patients typically after the 3rd session will notice a huge improvement in how they feel.
Great information. Do you have closing comments for us?
Yeah, as we've talked about before, and this is typically my close, is that any of these lung diseases require a proper diagnosis, because once we get a proper diagnosis, we can institute a proper treatment plan. So many of the patients, unfortunately, that we see in the office come to us without a proper diagnosis, and that's the first step in helping to get them to feel better.
Thank you so much, Dr. Basha.
Thank you for having me.
And thank you for joining us today. We've given you a lot of information, so if you have questions, you can call us at Health Access. That's 1-800-228-1484, or you can always go to our website, mclaren.org/PH contact. There's lots of great health information, and it's reliable on our website. Or you can order a copy of this program, and that's mclaren.org/PHTH. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.